is Representative Corvese's legislation 7403.
Thank you, Chairwoman. My name is Paula Hodges. I'm the Governmental Relations Director for Planned Parenthood of Southern New England. I am a Rhode Island voter. We stand in opposition to this bill, which would roll back decades of coverage, of a precedent of coverage in commercial health insurance plans for women who have always had access to abortion in their commercial health insurance plans. We are very proud of the fact that the Rhode Island Health Exchange, HealthSource RI, is a leader in the nation for enrolling over 35,000 low-income individuals in Medicaid and over, I believe, 15,000 these days in commercial health insurance plans. The Affordable Care Act has been an unprecedented opportunity for women to receive preventive health services, birth control with no copays, well-woman exams, and we see this legislation as a direct threat to start rolling back in a very dangerous cherry-picking way coverage for gender-specific services. We stand in opposition to this bill.
Thank you, Ms. Hodges. Questions from Ms. Hodges from the committee? There being none, Mr. Bracey.
Thank you, Madam Chairwoman and members of the committee. I introduced this bill earlier on behalf of Representative Corvese. Just a couple of points that I want to emphasize. The language of the bill is very clear and very brief for you. I can read it. No health plan under which coverage is purchased in whole or in part with any state or federal funds through the Rhode Island Health Benefits Exchange shall provide coverage for induced abortions except where the life of the mother would be endangered if the fetus were carried to term or where the pregnancy resulted from rape or incest. Coverage is deemed to be purchased with state or federal funds if any tax credit or cost-sharing credit is applied toward the plan. This section does not prevent an insurer from providing any person or entity with an optional rider for which there must be paid a separate premium for induced abortions, providing, however, that such coverage is not purchased in whole or in part with any state or federal funds. End of legislation. I read that because the intent of this bill is very clear and apparent. This bill is not regulating long-standing commercial health insurance plans and taking away coverage that women never had. Prior to the passage of and the implementation of Obamacare and the Health Benefits Exchange, there was no such thing in Rhode Island ever since the time of Governor Garrahy of any health insurance plan that was subsidized in any way with state or federal funds that included coverage for elective abortion. So what this language was very, very carefully crafted to do in 2011 was to apply, and in fact much of the language came from existing Rhode Island law, particularly those parts of the law that speak to the state payer of last resort program and Medicaid, and took that language and applied it to this new government program that we are creating. So nothing is being taken away that was there before. The intent of this language is very clear, which is again to maintain long-standing state prohibitions against abortion funding from paying for elective abortion. The purpose for that is it is unconscionable to force taxpayers to pay for something they find morally abhorrent, namely the taking of innocent human life. The bill explicitly allows for a rider so that those who would like to have abortion coverage can purchase it. The only thing that this does is it prevents state and federal funds in the form of the advanced premium tax credits from subsidizing coverage for elective abortion. Thank you, Madam Chairwoman.